I'd like to welcome each and every one of you to our Métis Nation Health Forum. This forum is an opportunity for our governing members to showcase Métis Nation approaches to health, including approaches to research, surveillance, policy, programs, and services.
You know, this is the new millennium we're talking about, 2018. And I want to ask you a question, and I want you to be very honest with me. Who really knows who the Métis Nation are in this room? Raise up your hands and be honest. If you don't know, it's okay. That's why they asked me to speak on this issue. Who really knows who the Métis Nation are in this room?
M&O research, why do we do it? We do it because there is none. There's been very, very little research until about 15 years ago, and it was acknowledged in many publications on Métis Nation health, on Métis Nation people generally.
If we want to eliminate chronic disease in society, we need to take a much more serious look at the social determinants of health, which is poverty, racism, and so on.
Our main goal is just to get Métis cancer needs on the map. It's just to help educate British Columbian care providers that Métis people are distinct. We have distinct needs, distinct issues, and distinct cultural mechanisms that we utilize.
Suicide is a huge issue for our youth. Métis youth in BC, I would say, they struggle with identity.
Métis people are 21% more likely to die before the age of 75 than all other Manitobans. We also learned that 34% Métis people are diagnosed with diabetes. The heart disease is 40% higher. Strokes are 24% higher than anybody in Manitoba, and their respiratory is 28% higher.
Housing is at the core of a lot of different things, but health being one of them. So if you live in a dry, safe, secure place, you're probably going to have better health prospects.
To all of us here that are dealing with health, we need to address the issues that start right in our communities. And we need to educate our people about drug and alcohol addiction.
So what we're going to be doing in about 75 communities across the province, we are going to be doing take-home naloxone kit training. We are also doing opioid awareness training, and it's led by the M&A. It's culturally appropriate, and we think that we will be able to affect some real change by getting those naloxone kits out into the communities.
We're listening to individuals, family members, practitioners, researchers, community leaders, and other stakeholders with a vested interest in improving healthcare systems and access to services for Métis citizens in Saskatchewan.
One of the things that we're pretty good at is working in a real broad area with people with mental health issues, mental illness issues, etc. What we haven't done is really look at all yet at these specialized programs for Métis people. And so today is a real good learning experience for our association and for us.
In the case of my cancer journey, I have come out on top. I believe the purpose of my diagnosis and my remission is to give the voice to the Métis and First Nations people of Saskatchewan.
We are really trying to listen, and you have told us that you want a Métis Nation specific process to be able to advance the shared priorities, the priorities that have been identified by Métis leaders across the country. And one of those priorities that rises to the top again and again is health and health care.
We urge our federal partners to invest in Métis Nation health and wellness in an ongoing and sustained way. It is essential that we address Métis health needs in the broadest and most comprehensive way. Once again, we thank you for joining us today. Merci, and thank you again.